This episode is brought to you by my free 3-part video series, FAM 101. Discover how to chart your cycles by tracking the 3 main fertile signs: cervical mucus, basal body temperature, and cervical position, and ultimately develop body literacy by paying attention to your fertile signs. Head over to fertilityfriday.com/FAM101 to grab your free copy. That's fertilityfriday.com/FAM101. This is the Fertility Friday podcast, episode number 229. Welcome to the 229th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. I'm excited to share today's episode with you. In today's episode, we're talking all about premature ovarian failure, as well as egg quality. And so, this is a topic that, especially the egg quality part, it's a topic that I get a lot of questions about, especially, in many of the women that I'm working with, especially women who are actively trying to conceive. And especially if you've done certain tests that show that potentially, egg quality or ovarian reserve is diminished, those types of things. So that is what we're talking about today: diminished ovarian reserve, premature ovarian failure, and also how to improve egg quality. So is there anything that we can do? And what I think is great about today's episode is that Maureen is a practitioner of traditional Chinese medicine, and what I think is really interesting about our conversation today is that we're talking about kind of like this East meets West. So whereas, Western medicine may have very little to offer you if you have this type of a diagnosis, how is this diagnosis looked at from a traditional Chinese medicine perspective, and how, it's really different. It's really interesting, the conversation that comes out today, because it's very much like, okay, so if you look at it from one perspective, there's basically nothing you can do. But if you look at it from the other perspective, there's all kinds of things you can do. And especially when you are trying to conceive, and if you've been trying to conceive for a while and it has been happening, it's really helpful to know what you can do. You don't just want to be told that there's nothing that you can do, because that's not always the truth. That's not always the full kind of picture. So it's one of the things that I've talked about a lot on the show, which is the importance of assembling your healthcare team, and to really recognize that no one practitioner has all the answers. So when you're dealing with specific challenges, and in particular fertility challenges, it's really important not just go to one type of practitioner or just really rely only on one modality. So for example, like Western medicine, it's really important to have a doctor, to have a fertility specialist. So you need a doctor. We all need doctors, at different points in our life. So it's not to say like one over the other, but it's to say that it's not only your doctor that you're going to need. There are other modalities, other practitioners that can support you. And so when you have a healthy team of healthcare practitioners, especially when you're facing a specific and serious health challenge, it's really necessary. It's really necessary not to just have one perspective, especially if you're wanting to address it in more than one way. So if you're the type of person that really wants to take matters into your own hands, you're willing to make, modifications to your diet and lifestyle, and you're willing to kind of look outside of, take pill A for problem B or whatever, you really need to have a more of a team approach to support you in that, so that you're getting the best care and not just from one perspective. So with that said, let's jump into today's episode. And today I'm very excited to welcome my guest, Dr. Maureen Rozen, back to the show. So for those of you who've been listening to the podcast for a long time, you may remember that I interviewed Dr. Rozen back in episode 41. So it's been a little while. I'm not even sure how many years it's been, probably like 3 at least. But Dr. Rozen has practiced integrative medicine for almost 20 years. She is a doctor of acupuncture and Oriental medicine with a dual specialization in women's health and pain management, and a fellow of the American Board of Oriental Reproductive Medicine. She teaches Masters and Doctoral students from various universities how to treat women's health, in addition to male and female fertility issues. Dr. Rozen is working on the second edition of her book, Your Fertility Program, aimed to assist people navigating the confusing field of infertility. And in today's episode, we're going to be focusing on premature ovarian failure and diminished ovarian reserve. So I'm really excited to have you here. Thank you so much for coming back to the show.
My pleasure.
But after a few technical difficulties, we finally made it on the call today. So I'm really happy that all of our tech is working. And so for the listeners who, if this is the first time that they're learning about you, I think that they could go back to our first episode and get kind of like the full background of your history, because I know I always ask about that. But maybe you could share with us, why much of your practice and teaching has focused on this area of women's health, particularly premature ovarian failure, diminished ovarian reserve. Maybe you could share with us what your interest is in that specific area.
Sure. That's a great question. Thanks for asking. So basically, when I was in my early 20s, I decided that I wanted to pursue acupuncture and Oriental medicine as my career. I chose Five Branches University because they had, as far as I could see, the best women's health program available. And then through my evolution of learning about women's health and learning about the difficulties and the nuances of women's health, I did my doctorate in women's health and pain management. And then the American Board of Oriental Reproductive Medicine was put together by someone very close to me. His name is Ray Rubio. He recently passed. And his passion was training practitioners, highly training practitioners, to bring them up and out of any kind of general, because practitioners are trained as general practitioners. So if you call an acupuncturist and you say, do you treat fertility? They're going to say yes, because they were trained as general practitioners who could treat eye disorders and fertility and ankle sprains. But he wanted a different standard for our profession. And so he was incredibly inspiring. And so anyway, hence the American Board of Oriental Reproductive Medicine, which has gone actually throughout the world at this point, was born. And it's a pioneer in research in terms of top-notch Western reproductive research and integrative or Chinese medicine research as well. So that's my background. And I treat women of all ages who have had difficulty conceiving. I treat them for a variety of women's health issues, from painful periods to painful intercourse to PMS or regular menses. I treat the whole gamut. But the diagnoses of diminished ovarian reserve and premature ovarian failure are particularly frustrating to people. And that's why I wanted to speak to it today, because if a person goes to a reproductive endocrinologist and they have a certain set of lab values and they have a certain profile in terms of their ultrasound results, they will frequently get that diagnosis, which basically means, sorry, we can't help you. You don't have enough eggs. They're not good enough. You don't have enough. And there's nothing we can do about it. And I've seen so many women come to me with this heartbreaking diagnosis, and it's simply not true. It's not true in that, not to say that reproductive endocrinologists are somehow lying, but that in another paradigm, in a Chinese medicine or integrative medicine paradigm, there are things that one can do to influence egg quality and influence egg recruitment. And so I feel very passionate about that. I feel, often people who get this diagnosis are people who, are between the ages of 28 and 43. Many of my patients have worked very, very hard to solidify several components of their life. Maybe they really wanted to find the right partner. Maybe they really wanted to get the right job. Maybe they really wanted to get the right house. Maybe they really put their energy into facilitating an environment in which they could bring in a child only to learn that, oh no, I waited too long. And that's not the message. That's not the message that I subscribe to, and it's not the message that I want my patients or the people who are listening to me to walk away from. Because egg quality is it's dynamic. It's not set.
Well, let's talk a little bit about some of the terms to kind of get everybody on the same page. And so maybe you could share with us, what is premature ovarian failure? When would a woman receive that diagnosis? And then I suppose once we've kind of gone through premature ovarian failure, then we can talk a little bit about diminished ovarian reserve.
Sure. So premature ovarian failure is I'm not going to just sound bad. Premature
it's horrible.
Failure. It just sounds terrible.
Your ovaries have failed prematurely. Have a nice day.
Yeah, it's heartbreaking. Yes. And so essentially premature ovarian failure means that a woman has stopped producing, often has stopped ovulating, but has stopped producing at least high quality eggs at an age that's what we would consider premature. So that would be before the age of 42, certainly before the age of 42, before the age of 45, and absolutely before the age of 49. And these women might experience perimenopausal symptoms even if they're 28.
So they're experiencing hot flashes and some of the symptoms characteristic of menopause. Potentially. They might. And do they stop ovulating and menstruating in order to get the definition, in order to get the diagnosis?
The diagnosis is made by both lab results, so blood tests, and most reproductive endocrinologists look at follicle-stimulating hormone, luteinizing hormone, estradiol, and anti-Müllerian hormone. And then it's coupled with an ultrasound to look and see, okay, what are the ovaries actually doing? Are they generating the appropriate amount of follicles on the appropriate day? So those two pieces of information together will will assist the reproductive endocrinologist in making the Western diagnosis of premature ovarian failure or diminished ovarian reserve. Diminished ovarian reserve is simply it's the same thing. It's just that you're older. So it's not premature that it might happen at the age of 44 or 42 or 48.
A question about premature ovarian failure. I mean, I've interacted with women who've experienced this or who've received that type of diagnosis. So when it happens, I mean, what you were saying in the introduction is that, Western medicine basically doesn't have an answer. So if you experience it, it's kind of like, sorry, nothing we can do beyond, IVF and those types of treatments. Is it possible for a woman to have a diagnosis of premature ovarian failure and then later regain her normal ovulatory function?
So that's a great question. I have two answers to that. Number one, think about how to phrase this. So number one, if a woman has a period of time where they're not ovulating and menstruating appropriately, and then they pick back up again, that's got a different definition. That's called resistant ovary syndrome. And Western medicine has no idea why this happens. No idea. It could be viral, it could be autoimmune, it could be so many things. But basically what they're saying is that, yep, you had a bump in the road, You didn't do it for a while, and now you're doing it, and that's great. So,
and is that similar to like hypothalamic amenorrhea, or are we talking about a different circumstance?
No, this would be when hypothalamic amenorrhea has been ruled out.
Right. Okay.
So this doesn't have anything to do with the pituitary or the thymus, or excuse me, not the thymus, but any of the components of the brain that interact with the ovaries that orchestrate the menstrual cycle.
Okay. And what did you say it was called?
Which one? I'm
resistant.
sorry.
Did you say resistant ovarian?
Yes, resistant ovarian syndrome, ROS.
And so that, just so that I understand, and the listeners as well, so that is a situation where a woman would stop ovulating for a period of time. It's not related to the hypothalamic pituitary, like it's not related to that situation, but
Correct.
There's potentially some other kind of serious issue, obviously, that's going on that's preventing her from ovulating. It's
a big fat question mark. That is the best way to put it. It's a big fat question mark where practitioners say, I don't know why you didn't ovulate. I don't know why you didn't respond to IVF drugs. I don't know why this didn't happen for you at this time, but now it is.
And you said it could be related to something like an infection or some sort of immune thing or something.
Yes.
Something like that.
Yes. That's the current thinking, is that it's viral or it's autoimmune or it's something that we don't have a handle on right now.
Could it be related to serious gut issues?
Could it be related to gut? Any autoimmune issue can be related to gut issues.
Okay.
Yes.
And what makes that different is that in those cases, the woman, like you said, stops ovulating for a period of time for whatever reason, and then at some point it comes back.
Mm-hmm. Exactly.
Okay.
I actually had a conversation not in the last couple of years with a reproductive endocrinologist that I really enjoy. He's a very nice man. I'm lucky in that the part of the world that I live in is the South Bay area. So I live about an hour and a half south from San Francisco. I live about 45 minutes towards the ocean from San Jose. We have so many reproductive endocrinologists in our area. And each reproductive endocrinologist has a certain skill set. I mean, they all can perform the same procedures, obviously, but they have a certain, I don't know how to put it, they have a certain shine to them. They have a certain gift. So some people are very good with autoimmune problems, and some people are very good with premature ovarian failure. Some people are very good with XYZ. And so depending on who my patient is, if I feel that they need a reproductive endocrinologist, I can select one and then direct them to that and work with that person. So my only reason for prefacing it that way is to describe the integrative fashion in which personally I work. I can and have and will and enjoy seeing patients, primarily just myself, because I can order under California law, I can order any kind of lab test I want. So any kind of ultrasound, any kind of x-ray, any kind of blood test, I can order and diagnose from that, which is great. It saves people a lot of money and it saves them a lot of time. But depending on what comes back and our discussion and the patient's age, also so many factors, I might select a reproductive endocrinologist for them. So I'm sort of exploring this topic of conversation to get to the point that I had a wonderful conversation with a reproductive endocrinologist within the last couple of years, and we discussed the diagnosis of resistant ovary syndrome. And I asked him, what do you think that's about? You know, the ovaries just stop ovulating and then they start again? Like, how do you explain that? And he said, we don't. We don't. We don't know. Sometimes it happens, and it's probably a virus, and it's possibly autoimmune, and we don't know. And it's just another great mystery of reproductive medicine.
See, I don't think it's a mystery. I don't think it's a mystery. So when you look at your menstrual cycle as a vital sign that is a reflection of your health, then you're find me a perfectly healthy woman in every way who just stops ovulating.
So I've seen that. I know. It doesn't make sense in the holistic viewpoint, but I have seen that phenomenon. And the woman I'm thinking about, it was very painful for her.
How old was she?
Very painful for her. She was mid to early 30s. So she's probably 33. But you're right. There should be a reason. There should be a reason. And in most cases there is. And that's the gift of holistic medicine, is that in most cases of people who are diagnosed with these confusing and seemingly dead-end diagnoses of diminished ovarian reserve, premature ovarian failure, resistant ovary syndrome, we have tools to regulate the menstrual cycle and to overcome these diagnoses, which is really ultimately the point that I'd like to make in this talk, is that there are ways to do that.
Well, so I think I feel like we kind of have a good sense of resistant ovary syndrome. So premature ovarian failure is what makes it different. Is it that the regular ovulation does not resume? Is that the main difference?
It's basically that menopause happens early.
Okay. And some women are now experiencing this in their 20s.
Yes. Yes.
And a controversial thing that I will say, and just own whatever fallout comes out of it, is that there's some discussion for some women that there's a link between premature ovarian failure at these young ages and certain vaccinations. So the HPV vaccination in particular.
Yes. So that's not my specialty, and I can't speak to it specifically. However, what I can speak to is this idea of that it's so darn complicated, and what is causing this non-response of the ovaries at a young age? Is it toxins? Can toxins bind to the hormone receptors that we need to be free in order for that pituitary ovarian orchestra to complete itself? That's very possible. So toxins and vaccinations can fall into that category. So, toxins, viruses, and also the Chinese have a very interesting idea about, and I don't know if this is the appropriate time to go into this, although it is a concept that fits all of these diagnoses that we've been talking about, and the overall umbrella of diminished fertility before you're quote unquote supposed to have that. Mm-hmm. So whether it's diminished, ovarian reserve or premature ovarian failure or resistant ovary syndrome, ovaries aren't working when you would expect them to be working, at age 36 or 28.
Maybe you can share with us so that we all kind of have a baseline of understanding, because this is one of the issues. I mean, this is one of the fundamental reasons why I started the podcast. As women, we're not really given much education about our fertility and what even is normal to expect. So maybe share with us, a regular woman outside of what we're talking about today, which is premature ovarian failure, diminished ovarian reserve, and resistant ovary syndrome. What would a typical, average woman expect? When would she expect to have her fertility naturally decline and naturally head into menopause?
Okay, so that's a great question. I'm going to try to answer that, and I'm going to try to wrap it into ways that can be influenced. So the Chinese is brilliant. The Chinese thousands of years ago in the sort of, I'll use this term because most people are familiar with the Bible, part 1 and part 2, right? So the Chinese sort of have a similar setup where they have a part 1 and part 2 of the cornerstone of classical Chinese medicine. And the first part is called the Su Wen, and that's where theory is discussed. And the second part is the Ling Shu, and that's where acupuncture techniques are discussed. So in the Su Wen, again, written a very long time ago, the Chinese talk about the natural process of aging for women. And they talk about the cycles of 7. So 7, 14, 21, 28, 35, 42, 49. And it's interesting when we talk about fertility, these numbers are very familiar, aren't they?
Mm-hmm.
Because Western medicine has realized the same thing. These are important numbers. So, at the age of 14-ish, we should be having our menstrual cycle. And then we grow into our fertility at age 21, and we grow into it even more at age 28. And then by age 35, things start to decline. Then by age 42, we can still get pregnant, but we don't have, without working at it, we don't have the vitality in our ovaries that we had when we were 21. And then at age 49, the body starts to get ready to stop menstruating. And when that happens, then all of that blood and all of that energy that a woman has been putting out for the last well over 20 years becomes hers. So she stops giving it every month and she just banks it. And it's a process, just like puberty was a process, menopause is a process. So that's the natural, quote unquote, that's the natural schematic. Now, this is the analogy that I use with my patients, and most people seem to really gravitate towards this analogy, and they seem to really get it. Everybody is born with a certain amount of money in their savings account. And some people get $3,000, and some people get $30,000. And if somebody's mother drank while they're pregnant, maybe that person only gets $1,000. So this is the strength of someone's constitution. Now, you can never add to that money. You got that money when you were born. It's in a bank account. That's all it is. It's done. It's over. You got that. However, if you take that money and you make good investments, you can compound it by adding principal to your bank account, right? So you used to have $5,000, but you made great investments, and now you have 20. It's still all money, but it's made a different way. Does that make sense?
I love that analogy. That's great.
So the way that that's made is how you live your life. It wasn't given to it wasn't given to you by your parents. You have to go out and invest your money and not spend it and let it accumulate. And when I work with women with fertility, this is a huge component of what I'm working with. Like, let's invest your money well. Let's get the interest from that. And then don't spend it. Bank it. Bank it. And so you can use that money/energy to invest into your reproductive system. Does that make sense?
That makes perfect sense. So tell me about the traditional Chinese medicine philosophy then regarding premature ovarian failure. And you know what I mean? Like how, because one of the points that I know was important to you to make was just the different philosophies around this, where one gives you hope and the other gives you no hope.
Yes. So I think the best way to describe this is to talk about a patient of mine. And it's not a happy story. I don't even know if I should describe it in this forum, but some people who are willing to change their diets and do energy work or acupuncture, take supplements, take herbs, and investigate, delve into their health and make that a priority, this is a good modality for them. People who are not interested in doing that, this isn't a good modality for them. And they should seek other modalities. So, once upon a time, I had a patient who didn't want to follow. I could see that the issue for her was that she had a deterioration in her egg health. And that's why her and her partner were not getting pregnant. Now, he was a heavy pot smoker, as was she. So they both had work to do because there are numerous studies showing that that's not a great idea if you're trying to get pregnant. But she was also unwilling to follow the diet that Chinese medicine suggested for her. Because the diet that Chinese medicine suggested for her included animal products. And she was incredibly adverse to that. That's fine. I worked with her the best that I could. But within 6 months, she wasn't pregnant. And so she went to a reproductive endocrinologist, and the reproductive endocrinologist said, oh, well, you have premature ovarian failure. Your eggs aren't good. It's not your fault. It's just that you are 39 years old and your eggs are, 49 years old. So in a Western paradigm, there was nothing she could do about that. That was the way it was. So in a Western medicine paradigm, that's the way it was. And so that alleviated responsibility from her, and it alleviated any type of action she could take, because she just thought, oh, okay, well, it doesn't matter what I do. I'm just, sort of doomed. And so, that was a challenging conversation to have, because what she didn't do was follow the traditional Chinese perspective on the rejuvenation of the reproductive system and how to generate and orchestrate and circulate energy in the eggs and in the uterus. Does that make sense?
Well, it sounds like it all ties in. So it ties in with the analogy of the bank account. So you're born with a certain amount of money. I like that analogy. And there's all of the things that you can do. So perhaps the main difference in the philosophy is that it's saying that there are things that, if we look at all of the factors in your life and your partner's life, if we identify certain factors that are known to reduce the quality of your eggs, reduce fertility, reduce the quality of sperm, etc., then we can actually make investments into our bank account, or at least reinvest some of that money and then have a better outcome. Whereas Western medicine is saying it's just the luck of the draw, right? Like you're just unlucky.
Yes, that's right. You're just unlucky. That's correct.
And it completely takes the power away from you, because if you're just unlucky, then there's quite literally nothing that you can do about it, is there?
it takes the power away from you, and it also takes the responsibility away from you.
So interesting.
Right? So not everyone with the diagnosis of premature ovarian failure can turn it around. I mean, this is not like, there's no guarantees in medicine. But this particular diagnosis of premature ovarian failure, diminished ovarian reserve, women feel defeated by. The women I see, the women that come to me, feel defeated by this because they feel like there's nothing I can do. And I feel so strongly that it's my job to say, no, there are so many things you can do. And let me show you what those are. And let's talk about what those are and how can those fit into your life. And there are people who it won't be a great fit for. And the people who won't be a great fit for are people who don't particularly want to make changes in their life because they're attached to it for whatever reason. Ethical reasons. They don't want to eat animals because it's because they have ethical reasons. The Chinese come from a perspective of famine. Vegetarianism makes no sense to a Chinese physician. They're going to use animal products in a way that is regenerative towards the reproductive system. So that doesn't mean, I don't want to give the impression that doesn't mean that if you're a vegetarian, then Chinese medicine can't help you. I'm just simply giving an example of the choices that we make. Does that make sense?
Mm-hmm. Well, and
I hope.
No, it does make sense because it sounds, let me try to phrase it and you let me know. So within this particular modality, there's an established, of course it's different for every person depending on what that person needs, but there's kind of an established trajectory of treatment. So once you've identified the issue, you're working with a practitioner, they're kind of identifying like how you fit within this modality, which in this case is traditional Chinese medicine. There would be, several recommendations that would be made as to how to improve the situation. And so if you're working with someone who's completely on board and are going to take all of those recommendations, based on the theory behind the modality, they may be more successful than someone who potentially is resistant to some of those recommendations. And it's complicated.
For whatever reason.
Yeah, because for women, especially who are dealing with fertility challenges, you could be the 13th practitioner that they're seeing who is now recommending for them to do something different once again. And they're, potentially understandably skeptical because, especially I work with women too. And I have never worked with a woman who worked with 5 practitioners who each said the same thing. Every practitioner says something different. And so it leaves women feeling very confused and understandably frustrated and skeptical when they enter into a new modality and this new practitioner is saying, oh, no, that's all wrong. You got to do this.
Yes. And it's so, oh my goodness. I can't underscore the importance of what you just said and the frequency with which I've heard the same sentiment over and over and over and over.
Well, it's the reality.
It's so true.
And especially being a practitioner of Eastern medicine, it really depends on the practitioner, the practice, the actual physician or practitioner. But there's definitely a lot of it's not even like your practitioner saying something sort of different. It's like you go to one person's office and they say the exact opposite thing as the other practitioner. And so, that's part of it too, because when you're going to a functional practitioner, someone who's looking at the root cause, a traditional medicine practitioner versus your Western doctor, depending on those practitioners, they could be saying very different things, not even sort of similar.
That's absolutely true. And I guess what I would suggest to those women who are kind of trying to navigate the landscape is to understand that they are going to different practitioners and to understand that and understand that practitioner's knowledge base. So what can that practitioner offer you, and what can they not, and what do they know? Because no practitioner knows everything, and nor should they. But these are just sections of a pie. They're just perspectives.
I couldn't agree more. I talk about the concept with my clients of an imaginary board of your basically your fertility team, or the team of practitioners, and understanding exactly as you said. I mean, each practitioner has their own area of specialization, an area for which they were trained and they are the experts in, but no practitioner is the expert in every area. So for the women listening, I'm sure that there's a lot of women who are kind of like, okay, so what can I do? My practitioner has told me that I have diminished ovarian reserve. My practitioner has told me that I have poor egg quality. My practitioner has told me that I'm old. They've told me that I'm of advanced maternal age. So the big question is, okay, so we've established what these things are, but what can we actually do about it? And, I just want to kind of put in that other question, because we live in a world where we're under the impression that age is kind of not a big deal. And, when we see women in the media getting pregnant at, age 45, age 60, age 55 or whatever, and we don't really have a background of how that happened, but we see it and think that it's not that big of a deal. So I suppose the question is, what can we do to enhance egg quality, build up the bank account, while acknowledging that there is an actual hard limit?
So that's a great question. And I'm going to try to speak to that, and I'm going to take about 10 minutes and speak to it, okay?
Okay.
Because it's a long question with a long
It was a loaded
answer.
one. It was a loaded one.
So basically, let's just look at what we can measure. So in Western medicine, we can measure how many eggs you have within 3 months. So the theory has it that as women, we are born with all the eggs that we're ever going to have. And they start little itty bitty tiny little dots in the ovary, and they mature and mature and mature, and they go through these rings, if you will, in the ovary of maturity until they get to a point where they're going to be ovulated. Okay, so 3 months is a very special time. That's when that premature egg starts to get messages from the brain, like FSH and LH. That's when it starts to be influenced by ovarian cells. That's when it starts to be influenced by the milieu of hormones that has to do with insulin and androgens. So basically, the egg that you ovulate next month, you started working on a year ago, which is an amazing thought. So with that in mind, there is no hard and fast rule. Does that make sense, first of all?
It does, because it gives some context to the concept of you're born with all the eggs you're ever going to have, and lets us know that there is time to make interventions.
Change them. Mm-hmm. Yes. Yeah. So for example, acupuncture, herbs, and nutrition can reduce the oxidative damage. So it can reduce the inflammation. So inflammation is this buzzword now, but we know that we can have it throughout our body, and it can affect our ovaries. And it can reduce that. It can increase the circulation to the ovaries, and it can protect the mitochondria, which is like the powerhouse of the cell, and the DNA of that egg. We can do it. And there are numerous studies saying this. Now, older ovaries tend to have less blood flow. So we can change that too. There's so many which is why it's such a difficult question to answer. It's because there's so many possible outcomes to a picture of, hi, I am 42 and I have diminished ovarian reserve. That could go so many ways. So anyway, another thing I want to put out there is that there are several supplements that have been shown to increase egg quality and increase circulation, enhance endometrial receptivity, etc., and so forth. And that's great. Those are wonderful things. However, the gift that a Chinese medicine practitioner has potentially over other types of practitioners is that they can tell what supplements might work for one person while other supplements won't work for another. And the reason that I'm saying that is because for example, let's take CoQ10. So CoQ10 is used to improve egg quality and its ability to hatch and its energy. CoQ10, from a Chinese medicine perspective, will do that job better in some people than it will in others because it depends on that person's energetic makeup. I know that's kind of we could talk about this for a whole nother hour. But so we could talk about basic nutrients for egg development, vitamin A, vitamin D, vitamin B12, iron, folic acid, zinc, vitamin D, melatonin, L-arginine. I mean, there's research behind so many supplements and herbs that can facilitate follicular recruitment and egg quality. But what's going to work for who? And that is the question that a gifted practitioner should be able to answer for you. Because there is no one sheet that says you should take this, and this, and that's the magic. And that's the magic formula. That makes sense.
It does. Well, and so if a woman wants to then improve her egg quality, right? Buzzword, any woman who's trying to conceive wants to improve her egg quality. So what are we looking at in terms of from a practical standpoint? I mean, obviously, if you go out and grab some multivitamins or, some coenzyme Q10 or something like that, it's not going to make a difference in your egg quality tomorrow. So for a woman who's thinking of obviously working with a practitioner who can tailor a specific treatment plan to her individual needs is the first step. But in terms of time frame, what does that look like?
So at least 3 months. So anti-Müllerian hormone is a hormone that's measured in the blood that tells us it's a hormone that comes from the ovary. And it gives us a little bit of a window into what the ovary is doing. What aside from follicular stimulating hormone that comes from the pituitary, it gives us a window into, okay, well, what does the ovary think that it's, how many eggs does the ovary think that it has? And how many does it want to hold back? And so it gives us an eye into what the ovary is thinking. And we want that anti-Müllerian hormone to reflect a healthy abundance of follicles. So some of the ways that we can do that, some really simple ways. For example, vitamin C is one vitamin that can be very important to facilitate implantation, prevent miscarriage, and help facilitate ovulation. If you're looking at trying to get more eggs to be ready, to be in line to ovulate, then we're looking at vitamin A as being very important. L-arginine is an amino acid that's also very important. However, if someone has herpes or cold sores, L-arginine can bring those on. So don't do that. Be careful. This is where someone who was working with a woman specifically would say, okay, L-arginine is either appropriate for you or not. The thing to remember is that your ovarian age does not have to be the same as your chronological age. So we can make our ovaries younger. We can do it by increasing blood flow to the ovaries. That's where acupuncture comes in. And it does so many things. And Chinese herbal formulas come in terms of reducing inflammation, improving implantation, scavenging free radicals, modulating the immune system. Other basic nutrients for egg development. We talked about vitamin A and beta carotene. We talked about vitamin D, B12, iron, and zinc, CoQ10, vitamin D. And then there's, I guess, because we're running out of time, unfortunately, because we could talk about this forever, but there's one last point that I'd like to make, which is often shocking to people. And that's the Chinese perspective on diet. So in Chinese medicine, if you are looking to be more fertile, you want all of those rich, nutrient-dense foods. However, you want to make sure that you can actually digest them and absorb them and make use of what you're eating. Most people can't digest those foods and extract those nutrients without that food being warm. So salads, which are the mainstay of Western nutritional, the word escapes me, but they're supposed to be very good for you in Western nutrition. In Chinese nutrition, salads are not good for you because they're cold and your digestive enzymes don't work at that temperature. So your body has to steal energy from other organ systems to heat that food up so you can digest it. So instead of having salads, have cooked greens, have spinach, have kale, have all of those nutrient-dense foods, but have them in a way that your body can extract the nutrients. And that will get people a long way. Also, eggs and chicken and lamb improve egg maturation and help the body recruit more follicles for the potential of ovulation every month. Lastly, about diet, stop eating sugar. Stop it. Stop. If I had one message, it would be, please stop eating sugar. And that means baked goods, and that means white foods, and that means candy. And instead, replace it with vegetables and high-quality sources of protein.
All right. Well, as we draw our interview to a close, because I know as you mentioned, we are running out of time. What is the biggest takeaway that you'd want the listener to take from our conversation today?
Gosh, the biggest takeaway is that just because you've been diagnosed with diminished ovarian reserve or any of the other diagnoses that we've been talking about does not mean that that's the end of the road for you. I know this not only because theory tells me this, but because I've seen it in my practice over and over and over and over again. There are things you can do. You are not passive. You do not have to be passive in this process.
Well, I think those are amazing words to end on. Well, thank you so much for being here with us, Dr. Rosen. As usual, it was a fantastic conversation. And I definitely encourage the listeners to go back and listen to episode 41 as well. In that episode, we spoke about thyroid function and fertility. And although it's been quite a few years, I remember that episode was one of my favorites. So for the listeners who want to learn more about you, more about your book, and also the listeners who happen to be in your area and may want to work with you, where can they go to find more information?
So the best place is to go to my website, which is acupuncturesantacruz.org. Or excuse me, .net. You'd think I'd know my own website by now. Okay, .net. acupuncturesantacruz.net. And yes, there's quite a bit of information about me, my background. There's plenty of blog articles, and there's just a tremendous amount of information. This is October, is Breast Cancer Awareness Month, and I have a thermographer come to my office every 3 months to help women detect breast cancer earlier than a mammogram might. So that's something that's current, that's happening right now. And if you're interested in that, please call us. If you have any questions, please call us at 831-426-1093.
All right. Well, I will include that information in the show notes page. So for the listeners on the go, they don't have to remember that. But thank you for being here with us.
Oh, it was my pleasure. It's so great to connect with you again after all this time.
Yes.
Thank you for listening. If you enjoyed today's episode, please share it with a friend. You'll find the show notes page for today's episode over at fertilityfriday.com/229.
I hope you enjoyed today's episode with Maureen. It was such a treat to have her back on the show. I'm pretty sure it's been at least 2 years, possibly 2.5 years since I had her on the show, because she was back in episode 41. So in that episode, we talked all about thyroid health. And so if you enjoyed today's episode, definitely check out the first episode that we did together. So fertilityfriday.com/41. And also, if you are interested in learning more about how to improve egg quality, I recently released an episode with Warren Cargill. That's episode number 216. So fertilityfriday.com/216. And that episode was particularly interesting because we were talking about improving egg quality, but focusing on the mitochondria, so the energy centers of the cell. And so a lot of really interesting and incredible nuggets came out in that interview. I feel like for the first half of it, my mind was so blown that I couldn't even keep it cool. I just was like, whoa, this is crazy. How many mitochondria are in the egg cell again? So I was really just enthralled by that episode, but it really gives you more of a tangible idea of what you can do to actually improve egg quality. And with that said, what I know from working with women over the years in, the different programs, whether it's the group program or my one-on-one programs, teaching women to chart their cycles, and especially when I'm working with women who are trying to conceive, is that we always think it's all us. So, it's got to be my egg quality. It's got to be my menstrual cycle. It's got to be me. And so while we're talking about the importance of improving egg quality, sperm quality goes hand in hand. And I think one way to remember is that anything that's going to improve your egg quality is also going to improve his sperm quality. It's very interesting. These things are very complementary. And so a lot of the very same approaches that you would take to improve egg quality also, by the very nature, improve sperm quality as well. And there's a lot of research to support specific ways to improve, whether it's morphology and sperm count and also sperm motility. So just to throw it out there, if egg quality interests you, definitely listen to episode 216. But also I would suggest to go back into the archives and listen to episode 134 with Mark Sklar. So fertilityfriday.com/134. And so in that episode, he talks all about how to improve sperm health and also shed some light on what is actually normal. Because it's really important to not only get the sperm tested if you're having challenges with fertility, but also to ask for the test so that you can actually look at it. And if you've had your partner's sperm tested, then, grab the test have it open when you're listening to that episode, because he goes through, what's actually normal. And often what's interesting just in general is that you can have one test and you can have two different practitioners, and one practitioner can look at it and say, yeah, that's totally fine. And another practitioner can look at it and say, well, that's not really optimal. Here's why. So I think it's really important to keep that data for yourself and either go through it with your practitioner just in detail so that you at least know what's what. So with that said, I just want to thank you for taking some time out of your day to tune into today's podcast. I really appreciate you for being part of the Fertility Friday community. I really appreciate all of you for sharing the show with your friends, sharing specific episodes with your friends, and just really spreading the word about fertility awareness, about body literacy. I really appreciate all of you for that. So with that said, have a wonderful day. And as always, until next time, be well and happy charting.